The CSDB logo with a collage of 9 videos in the background zooms out and fades to a solid white background. Title: Interventions for Autism Spectrum Disorder with Children Who Are Deaf, Hard of Hearing. Deborah Mood, Ph.D., licensed psychologist. Part 3. A split screen shows a sign language interpreter on the left, and on the right, our presenter, Deborah Mood, is sitting in front of a solid background. Captions are below on screen.
Intervention for communication with children with reduced hearing who also have autism is very complex and requires a multifaceted approach. We have to make sure to consider those core symptoms of autism. So if a child is having difficulty communicating, there are several different things that we know about autism that it's helpful to think through in designing our interventions. So, for example, we know from the literature that children who have an autism spectrum disorder who are users of technology like cochlear implants show benefits from the use of that technology, but may not have the same gains as their typically developing peers who are using the same intervention. And so thinking about autism, we might want to look further at that, about what we know about autism, and think through, well, why is it that they're not showing the same gains? Are we making sure that they're receiving the kinds of interventions that are targeting those core symptoms of an autism spectrum disorder? Are they getting access to ABA and other interventions to target acquisition of language? Are we making sure that they're using the devices that if a child has sensory sensitivities because of their symptoms of autism that are making it uncomfortable for them to tolerate certain sounds or to have things on their heads, that we're using the strategies that we might use to desensitize them to that so that they're able to benefit from the technology that's available to them. Similarly, if a child is having difficulty using sign language expressively, even though based on their preferences and their family preferences and their needs, even though that seems to be what would be most beneficial ideally, if they're not able to produce signs, then we might think through what we know about autism in targeting in our intervention. So we might look at, well, gosh, is it that they really have poor imitation skills and we need to take a step back and think through how we're teaching them to imitate. Whether we're building the motor skills to be able to replicate those signs so that they can produce them more effectively. Whether we're setting up social situations to reinforce them for using approximations of signs. Rather than stopping signing with a child when they're not able to produce it themselves initially. In hearing children, we would not stop, in hearing children who have autism, we would not stop talking around a child who's hearing who has autism just because they're not speaking, right? So similarly, in a child who's deaf and hard of hearing, if they're not able to produce a spoken word or a sign initially, we're not going to stop providing that feedback and that communication access in their environment. We want to encourage you to keep speaking and keep signing and keep bathing them in language, even though there might be more of a delay in their ability to show you that they're understanding. You also would think through whether we need to build some additional supports here. If language is this very abstract thing, regardless of the modality that isn't making sense to the child, we might think through ways to make it more concrete to them, like using some of those picture supports. Similarly, if a child, sometimes we see children who are communicating in sign language who have autism who are repeating everything that's being signed to them. So you might ask them a question and they just sign the same thing that you just signed. This can be a clue that the child either may not understand what's being signed to them, or it can be a symptom of autism called echolalia. And so rather than stopping signing because the child is doing that copying behavior for either of those reasons, we want to think through including those visual supports, modeling the language as you want it to be said from their perspective, and working towards expanding their spontaneous communication. In terms of educational intervention for children who are deaf and hard of hearing who also have autism, this can be extremely challenging and frustrating for families because children sometimes need a very specialized type of program. And so unfortunately we really don't have many settings that were specifically developed for deaf children who also have autism. And this means that the parents are often finding themselves trying to decide, well, should I put them in the program for children who are deaf and hard of hearing and hope that and build in some autism supports there, or should I put them in a program for children who have autism and hope that they're getting enough communication support in that environment, or that we are able to build enough communication support in that environment? Therefore, we have to really think flexibly about what educational environment is going to be most appropriate for the child who's deaf who also has autism. Again, just like in terms of communication and what their needs are for understanding and using language, that can shift over time. The educational program that's going to be the best fit might also shift over time. For example, we might see for very young children whose autism symptoms are making it difficult for them to engage with their environment and to learn and understand language. An autism program early on might be appropriate for that child to help build their engagement with their environment and their availability for learning language, or their motivation for using language. And then we might need to shift them into a program that was more initially developed for children who are deaf and hard of hearing, and build some autism supports in that environment. This can be challenging depending on what's available in your area, and the willingness of administrators and parents and staff to be flexible in thinking through what kind of program is going to be most appropriate for the child who's deaf and hard of hearing. One thing that might be beneficial is to think outside the box a little bit about autism intervention for kids who are deaf and hard of hearing. So especially in areas where it's not possible to find a provider who's trained in both communicating directly with the child and autism intervention, you might consider co-treat models, where the specialist in autism might work with the child's deafness-related experts and maybe train the deafness experts on how to use the model, or having experts from the school come to the clinical setting where they're working on autism intervention. Again, thinking outside the box for intervention and for children who have this complex comorbidity could be really beneficial. We've talked today broadly about a number of different interventions for treating an autism spectrum disorder, as well as some unique considerations in thinking through intervention for children who are deaf and hard of hearing who also have an autism spectrum disorder. I'm hopeful that you'll look through some of the resources that are available to you at the end of this presentation in order to learn more about these interventions, to be able to determine what interventions might be most beneficial for the specific students with whom you're working. An aspect of intervention for an autism spectrum disorder that is unique to children who are deaf and hard of hearing is how the symptoms of an autism spectrum disorder may impact the child who's deaf and hard of hearing ability to use technology that's available to them, like hearing aids and cochlear implants. As I mentioned earlier, the research has indicated that when we look at outcomes of cochlear implant use for children who are deaf and hard of hearing, those with an additional secondary disability, like an autism spectrum disorder, often do not perform as well as they're typically developing deaf and hard of hearing children. Parents of children who have an autism spectrum disorder who are also deaf and hard of hearing often report that their children benefit from their technology and are able to show improvements in their ability to respond to their name and respond to verbal requests and enjoy things like music, but may have slower progress in their acquisition of speech and language than typically developing children who are deaf and hard of hearing. However, this research is mixed because one thing that it doesn't look at is whether the children who have an autism spectrum disorder are getting intervention for the symptoms of autism that we know can interfere with their ability to acquire language and to use their technology, like their cochlear implants, as frequently as their typically developing peers. One thing that the research on outcomes for children with autism who are deaf and hard of hearing doesn't show us is the reasons why they show slower rates of progress acquiring speech, or why their outcomes might differ from typically developing kids who are deaf and hard of hearing. However, it's reasonable to think that some of what we know about symptoms of autism can impact their both their willingness to wear and use the technology, as well as how they respond once they are using the technology. Because I commonly get questions about that first step of that, how to encourage children with autism to use their technology, I'm going to start there and provide just some brief tips to encourage use of cochlear implants and hearing aids for children for whom that might apply. This intervention really requires collaboration between the child's audiologist, their parents, and their other interventionists to be able to identify where the challenge may be. For children who are struggling to even tolerate wearing an external device on their heads, first it's important to rule out whether the device is functioning properly. So consultation with the child's audiologist is a reasonable first step. For the majority of children, it's reasonable to think through whether there might be some other sensory processing difficulty that's impacting their tolerance for wearing the device. So a good clue to whether sensory difficulties might be impeding your child's willingness to wear their hearing aids or cochlear implants might be to think through whether they have sensory sensitivities to other things. Are they struggling with things like cutting their hair or taking a bath at night? Do they resist wearing other things on their head like hats, or do they resist touch overall that isn't initiated by the child? That might be a good indicator to think that tell you that the child might have some sensory processing difficulties that might be impacting how well they can tolerate wearing a hearing aid or a cochlear implant. If that's the case, then it's important to consult with the child's audiologist, as well as perhaps an occupational therapist, to help you think through some steps to desensitizing the child to wearing their device. I'd encourage you to start small, to work towards wearing the hearing aid or cochlear implant for a small amount of time. During an activity that ideally to start with wearing the device during a highly enjoyable activity, something that your child really enjoys, especially one where their hands are ideally occupied. So that might be playing in a sandbox, or playing in beads or beans, or playing with Play-Doh if they like playing with Play-Doh. Or playing a video game, or watching TV, or a technology, or like an iPad if that's captivating to them. So ideally you would start during one of those activities that they really enjoy, where their attention is diverted somewhere else, and so they're not focused on what's being placed on their head. And then start with small increments. So sometimes putting the hearing aids on their heads for a very short period of time and then removing them before the child has a chance to remove them. The reason that this is important is that it helps the child, if you remove it before they do, before they indicate some discomfort, then it helps build this association between wearing the device and a tolerable experience. Once you get to the point where the child is struggling with wearing the device, they've already experienced some discomfort with it, and so it forms a negative association with the device. So again, the idea is to start small, make it all positive for the entire duration that they have it on, even if that's a very short duration. Then you can work on gradually increasing the amount of time that they're wearing the device. Again, trying to make it a positive experience for the child. There might be some children for whom you need to take a step back and perhaps start even further back with desensitizing them to the idea of something touching their head or their ears. So there are ways to do this that are playful and feel less intrusive to the child and to you, such as for the young child, several times during a day, playing playful activities like with infants and toddlers, where you might be playing head, shoulders, knees, and toes, but kind of lingering over their ears or wiggling their ears playfully as you do that, and doing that several times throughout a day over several days before even trying to get the hearing aids or cochlear implants on, to get them used to the idea of something touching their head. You can do it playfully by also playing silly games where you have them wear funny hats or glasses or things like that, just to get used to the idea of something being on their head or their face in a playful, fun, rewarding manner, and then gradually building out to putting the hearing aid or the cochlear implants on. For some children, it might be appropriate in consultation with their audiologist to think about whether you put the device, the hearing aid or the cochlear implant on their bodies, but don't activate it yet until they're able to tolerate the sensation of something on their head without the added sensation of of hearing something that may or may not make sense to them initially. So as with all intervention for autism, it's really important to think through why you're selecting the intervention. So thinking through what might be some possible explanations for why the child might be resisting wearing their hearing aid or cochlear implant should be what guides your decision in terms of how you choose to intervene. So we would intervene differently for the toddler who's removing things like their hearing aids and cochlear implants just as because they're toddlers and that's what toddlers do, and the strategy might be just to consistently put it back on until they become used to it, versus the approach that we might take with a teenager who's resisting wearing their cochlear implant because they're afraid that it makes them look differently, versus a child with autism who has sensory sensitivities that makes it uncomfortable for them to wear the cochlear implant, and therefore we need to desensitize them to become more comfortable with it over time in order to encourage them to wear their cochlear implant. Again, in thinking through intervention in this regard, thinking about what we know about autism can be helpful. So in some situations, knowing what we know about autism, like that children with autism sometimes have special interests, things that they're intensely fascinated with, might be something that we can use in developing an intervention. So for example, if a child really likes Elmo or a certain color or Thomas the Tank Engine, you might be able to capitalize on that interest by using a skin-it or a cover or a sticker on their cochlear implant or hearing aid that makes them more interested and engaged with it and more tolerant of it. We know that children with autism can have sensory sensitivity, so in addition to desensitizing them to being able to tolerate wearing the hearing aid or cochlear implant, you might think through alternative ways to wear the cochlear implant. So like off the ear, pinned up in the hair, somewhere where it's less uncomfortable for them. Again, you might also try wearing it turned off at first, or wearing just the external part before wearing the internal ear mold. And making sure that that sound is reinforcing to them, that the information that they're getting through the hearing aid or the cochlear implant is something that they understand and that they're comfortable with. Otherwise, sometimes it's helpful to modify the volume on the devices in consultation with your audiologist. Some children with autism can also be really rigid about things. They can, for example, only want noodles if they're from a particular red package with a particular brand. And again, if we're flexible about how we think about intervention, we might be able to use knowing that about the child in developing our interventions. So if a child has been resistant to wearing a hearing aid, they don't like it, they're refusing to wear it, they might be resistant to only wearing their beige or neutral colored hearing aid, but once we work on desensitizing them to touch on their head, we can reintroduce the hearing aid with a different appearance, like a different colored ear mold or a different color or a skinnet on it that in their minds might make it be something entirely different than the one that they were so aversive to in the first place. And so in reintroducing it as something different to them and making it a more positive experience this next time around, we've sometimes seen some success with that with children with autism. So again, intervention really requires thinking flexibly, being creative, and taking into consideration what we know about autism and what we know about technology for kids who are deaf and hard of hearing to be able to develop a highly individualized intervention that's going to meet the needs of a specific child.
Title: Interventions for Autism Spectrum Disorder with Children Who Are Deaf, Hard of Hearing. Deborah Mood, Ph.D., Licensed Psychologist. Part 3. This has been a production of CSDB Outreach Programs. Logo: Excellence in Service, Colorado School for the Deaf and the Blind, established 1874. Learning, Thriving, Leading. 33 North Institute Street, Colorado Springs, Colorado 80903. Telephone 719-578-2100. www.csdb.org.